All right, we are right on the hour, so I think we'll go ahead and get started. I just wanted to thank you all for joining. We may have more folks joining as we begin here, but we'll just run through some of the housekeeping items and then we will be off and running. Welcome to today's session. We are going to talk a lot about a culture of safety and specifically about the just culture implementation in our Indian Health Service units. Just a reminder too that all of our PATH Leadership LAN tools and resources, recordings of previous events can be found on our website. So you can follow the website listed at the top of this page here below or visit healthinsight.org/PATH, P-A-T-H, and click on the staff development and training page. Hopefully some of you visited that page before our session. We did post a couple of articles, papers that were suggested pre-reads before this session. They can also be read after, of course, but hopefully some of you got a chance to take a look at those resources. Next slide. I just want to take a quick moment and introduce myself. I'm your facilitator for today. My name is Carrie Howard. I am the PATH Project Manager in beautiful northern Minnesota. I'm a certified professional in healthcare quality and a certified professional in patient safety. I do also have a couple of behind the scenes facilitators helping me out today. So thank you, Elaine Villa and Lori Hested. A huge thank you for helping make sure that this session runs smoothly. Please feel free to reach out to me, Elaine, or Lori using chat at any point if you have questions or technical issues. And if you'd like to send us a private message, please select one of our names from the to drop-down list in the chat. And otherwise, you can send your general questions to the whole group. For those in our chat to function, Elaine, Lori, and I should be at the top of your list. They're listed as the host and co-hosts. So we should be easy to find. All right, next slide. So I just wanted to introduce our agenda for today. We do have a couple of changes. I am going to introduce or review what it means to have a culture of safety, and then just do a brief overview of the outcome ingenuity just culture model. So that is the model that IHS has been implementing. And then we will hear from 3 different IHS facilities. So we will hear from Olu at Crow, we'll hear from Ellie at Cass Lake, and we will hear from Jennifer at Claremore. And then we'll have plenty of time for you all to ask questions of the 3 of those presenters, or of me, or of anyone else in the group as well. And then we'll take just a few minutes to preview our next session for September, and then to launch the poll so we can capture your feedback and comments from today's session. All right, next slide. All right, thank you. Actually, can you just go back one slide, Elaine? Thank you. I just wanted to start today's session by reviewing what it means to have a culture of safety. And then, like I said, we'll briefly introduce the just culture model that IHS has been adopting. And just to begin, I wanted to provide a definition of culture or organizational culture. And an organizational culture is how an organization behaves when no one is watching. It's the product of the individual and group values, attitudes, competencies, and patterns of behavior that determine and display an organization's commitment to its health and safety programs. Next slide. All right, you may have heard this term before, but culture eats strategy for lunch. Organizational strategy is how we want to be, but culture is how we are. Our strategy is our plans and our policies, but culture is more like our personality. It's how we behave, it's how we interact with one another, it's how we feel, and most importantly, it's the driver of if and how we actually follow through with our strategy. So you can see that our strategy is some of our technical changes, our policy changes, those kinds of things, but our culture is our adaptive change. A strategy is something that, you know, we take an assessment of where we are and where we want to be at a certain point of time, but culture is an ongoing kind of the life and breath of an organization. Next slide. In a culture of safety, we begin moving away from a reactive focus that emphasizes events, errors, and outcomes, and shifting to a proactive approach to identify risk before an event occurs, to thoughtfully design safe and efficient systems, and to make it easy for people to do the right thing. Next slide. I know this slide looks really busy, but it's really just to demonstrate a point that when we think about a culture of safety or implementing just culture, sometimes we think of it as something new or an add-on to our daily work, but it really is integrated into everything we do. So the list on this slide is just a few examples from the Joint Commission's Critical Access Hospital Manual, and there are similar standards for larger hospitals and clinics, but you can see that there are safety standards in the leadership chapter, in the performance improvement chapter, environment of care, infection control, medication management, provision of care, and even the basic accreditation participation requirements. So safety and this culture of safety is not a separate initiative. It's not something new. It really is something that is woven into everything that we do and is foundational. It's a foundational element in providing healthcare. Next slide. All right, this model was developed by the Institute for Healthcare Improvement, or IHI, and this came out in a 2017 white paper entitled A Framework for Safe, Reliable, and Effective Care. This is one of those pre-reads or those articles that you can find on our LAN website for today's session. And this really defines the 9 foundational building blocks of a culture of safety as defined by IHI. One thing I do want to point out too is that leadership overlaps both the culture category and the learning system category. And there are just a few items, a few puzzle pieces that I wanted to highlight as they are key in our Just Culture work and conversation today. And one of those is at the top there, you can see psychological safety. And so this is really about respectful and professional behavior, listening to each other to understand, not to respond or to rebut, and also inviting ideas and opinions. And then kind of almost directly across from that in the model, we have continuous learning. So again, this is being testing, studying. This is why and how could this work, not why won't it. This is where we are innovative, we're constantly learning from mistakes, and we are in that process also being transparent. So that's another one of those pieces, the transparency. So we don't hide our errors or events, we share information and learn from it. We admit our mistakes to patients and even the public. We apologize without excuses or blame. We explain steps that we use to correct and prevent those things from happening in the future. And we also display and share data. All right, next slide. I just wanted to dig in a little bit further into the leadership piece of the previous framework. So this model was actually developed by the American College of Healthcare Executives and the Lucian Leap Institute in partnership with IHI and the National Patient Safety Foundation. And this is from a paper called Leading a Culture of Safety, a Blueprint for Success. So this was also published in 2017 and also is available to you on our PATH LAN website. So please do take a look at that. But in short, this paper and this model basically tells us that leaders play an integral part in building, nurturing, and strengthening the culture of safety. One thing I do want to say too is that leadership is for both formal leaders in leadership positions, but there are also informal leaders that can be key players in the success of your culture of safety work and your just culture model. So you might have frontline staff that maybe aren't in a formal leadership position, but they really are the champions. They're the engines of this work. And active leaders support the culture of safety. They have a set of shared values. They set expectations for performance and behavior, and update or implement policies for the culture of safety, using protocols and procedures to help define the structure for a culture of safety. But they also model the behavior. So leadership is about authenticity and humility. It's about being able to admit when we are wrong as well, retroactively and proactively. It's a commitment to that learning. It is honoring. You may be familiar with the term stop the line. So if somebody says, whoa, hold on, I've got a concern, that we stop and we listen to that concern and address those as appropriate. Leaders hold ourselves and others accountable and empower staff. So we invite staff participation and feedback. We allow staff to be creative with solutions and improvements. It's often true that they are the experts in their processes and in their field, and they tend to come up with the most creative and best solutions for a lot of our improvement work. And we also empower them to take the reins when it's appropriate. So we give them a little room to be creative and to lead in their own areas. Next slide. So these lists were adapted from HPI, or Healthcare Performance Improvement, and was presented in a leadership workshop. But I really wanted to share them because I feel like it's really important to note that they have listed the primary embedding mechanisms are related to leaders and how leaders behave. And the secondary mechanisms are related to the structure, strategy, and policy. So again, this is telling us, this is reiterating that leadership is really the cornerstone of culture. Next slide. And last on this more general topic of a culture of safety, I just wanted to take a moment to recognize that changing an organizational culture is a marathon. It is not a sprint. It takes commitment and dedication, resiliency, or the ability to pick yourself up and keep going even when you don't want to, and the dedication of lots of time. So within an organization, it often takes 2 or 3 years before you really start seeing the impact of your work in your data. Sometimes things can show up a little more quickly than that, but moving or changing an organizational culture takes time, and it takes that dedication, just like training for a marathon or a big event. Next slide. All right, I'm going to shift gears a little bit and focus in specifically on the just culture model that IHS has been adopting. And this model has been, or was developed by David Marks and his company Outcome Ingenuity. We've got several IHS just culture champions that have been trained and certified through Outcome Ingenuity. And I just wanted to provide a brief overview of that model and that content for those that may not be familiar with it. And so fairness, this is about fairness and just culture. So just culture is where we are accountable for our behavior. And there's a distinction between human error and poor choices. And we've got zero tolerance for reckless behavior or intentional harm. And when we're talking about just culture, this applies to all employees, regardless of position or title. Next slide. I really like thinking about our foundation of shared accountability with this Venn diagram model. So the sweet spot for shared accountability is where everyone is holding themselves and other staff accountable for ensuring safety and the well-being of all. So we've got leadership that's holding individual staff and teams accountable for their behavior. And then likewise, those individuals and teams holding leadership accountable. So there's some peer coaching, some team building coaching components. But like I said, that sweet spot is where everyone is holding each other and themselves accountable for safety for themselves and for our patients. Leadership too is accountable for designing safe systems and responding to behavior of employees in a fair and just manner. And then employees themselves are accountable for their own choices and behaviors, for reporting errors and potential errors, and for respectfully helping and coaching others. That's not to say that leadership is exempt for the things that all employees are accountable for. So as leaders, you are also employees, and so you also have that responsibility for your own choices and behavior and for reporting errors and potential errors. Next slide. This is just a really nice slide that summarizes some of the language that this model of just culture uses. So in Outcome Ingenuity's just culture model, there are 3 fundamental human behaviors: human error, at-risk behavior, and reckless behavior. And then depending on how we determine or what we determine that behavior to be, there are different approaches or responses to that type of behavior. Can you go back one slide? Oh, wait, that was me, not you. Sorry. Sorry, Eileen. Okay, so when we have a human error, that's where we're going to console our staff and say, I'm sorry that this happened, and what can we do to prevent this from happening in the future. When we have determined that there has been at-risk behavior involved in an event or identified area of risk, that's where we're going to coach our staff. So we're going to, help people, either redesign systems or help them make better choices, easier choices moving forward. And when we get to reckless behavior, so this is the conscious disregard of substantial or unjustifiable risk. This is fairly rare when we're actually looking at events, but that's where we might have remedial action or punitive action as far as how we respond to individuals and their involvement in an error or in an event or risky behavior. So the biggest differentiation here between human error and the other 2 categories is that human error really is a mistake. So there's no specific choice made. It's a slip, it's a mistake, it's an accidental, spilling of coffee in the hallway or something like that. Where at-risk behavior and reckless behavior are choices, where the employee is choosing to behave in a manner that the organization finds risky or puts others at risk. All right, next slide. Within this model, there are also 3 duties that are defined. So one is the duty to produce an outcome. 2 is to follow a procedural rule. And then the ever-present duty is to avoid causing unjustifiable risk or harm to others. So the duty to follow a procedural rule is pretty simple in that if we have a policy or procedure written out, it is expected that all staff, all employees are going to follow those written instructions. The duty to produce an outcome is a little bit different, in which we have defined the end result, but haven't necessarily defined the procedural component of that. So this is things like showing up to work on time. We say your shift starts at 8 o'clock. We expect you to be here in the building and ready to hit the floor at 8 o'clock. We don't define how you need to structure your morning routine, or what time you need to wake up, or what route you need to take to get to work, but we have defined the outcome. And then like I said, the ever-present overarching duty to avoid causing unjustifiable risk or harm. So if we're not sure which category it falls into as far as producing an outcome or following a procedural rule, you can always default to this duty to avoid causing unjustifiable risk or harm to others. Next slide. So outcome ingenuity then has taken these terms, those 3 behaviors and those duties, and has created several algorithms that help leaders and HR staff and employees walk through, in a structured format, the analysis of what was a contributing factor to the error or event or the potential risk. So this is extremely helpful when we're following up with individuals that have been involved or have identified areas of risk. And it just provides a really nice structure for us to determine which human behavior may have contributed and how then we are going to respond to that behavior in a just manner. And next slide. And just in summary, the expectations of Just Culture is that everyone supports the learning environment. So we report our events, near misses, and areas of risk, and that we are active participants in the investigation or improvement efforts as appropriate. And then most importantly, that we are accountable for our own choices and behavior. All right, next slide. With that, we are going to shift into hearing from our IHS facilities that are in the midst of our Just Culture implementation efforts. And we will first hear from Ulu. Please correct me if I get this wrong, but Ulu Oshunbunmi out at the Crow Service Unit. I was way off, wasn't I? I'm sorry.
Can you hear us?
Yes.
Can you hear me? Okay. Hello, everyone. My name is Oluwaseun Oshibumi, Olu. Just quick info about myself. I told you my name. Currently the new designated patient safety risk manager at the Crow Service Unit in Crow Agency, Montana. So quick review on Crow Service Unit. We are a critical access hospital. Hospital that serves 24 critical beds. Our services include inpatient, ED, outpatient, dentistry, swing beds, and many more. Crow Service Unit. Crow Service Unit also service satellite clinics located in Pryor and Lodgegrass area, which is about 20 miles to 45 miles away from the main hospital. At this time, we have 3 certified individuals in Just Culture, and I'll talk more about what we've done so far moving forward. Next slide, please. So implementation plan that we have done so far, as part of the leadership, Just Culture is part of our service unit strategic plan and QAPI plan. for the 2018-2020 plan. We also planned to train and certify champions of just culture. And this champions are ones that were selected that we felt that they will be committed and were willing to show the initiative of being role models for the staff. We also plan to incorporate the Just Culture training as part of the employee orientation. Just Culture has also been a required competency for all hospital employees. We also have the CEO that facilitates the daily safety huddles where we can discuss, you know, action plans in improving the just culture of the hospital. We also have daily clinical rounds, which involves the exec team. As for the patient safety committee, one of the things that we, Crow Service Unit has done is have me join the team as the designated patient safety risk manager nurse. Also, we have the AHRQ safety surveys, which will be conducted annually, and I'll have Alona talk about that more.
So it was probably around last October that the Crow Service Unit passed around the AHRQ Culture of Safety Survey to their staff, and approximately 76 employees completed that, which there have been more since then. And they're using that as a baseline to determine where they fall as far as implementation and where their gaps may be as far as implementing just culture and implementing a culture of safety within the facility. Currently, they are looking to determine how they will move forward after PATH is gone, due to the fact the SurveyMonkey link may go away with the PATH project ending in December of this year. So they are working on that, and they're just keeping an eye on their baselines. And then they're also using an Excel tool that the PATH project manager, myself, and as well as another PATH project manager from Montana, helped to create an Excel worksheet to give them a dashboard so that they can give it a high-level overview of how well they're doing so far implementing their just culture of safety and just culture. So,
okay.
Thanks, Alou.
Oh, no problem. Thank you, Alona.
Yeah. And I do want to also give a shout out to Crow Service Unit for recently being awarded a full accreditation to Joint Commission. So I just want to give them a brief pause and applause for that.
It was a team effort.
Yeah.
So for policies and procedures, we have been able to implement the Sentinel event policy and culture of safety policy, which was included in the 2019 QAPI plan. Next slide, please. So, so what have we done so far? We've had 5 executive team members and 2 supervisors attend the training in 2018. And in 2019, we have 3 certified champions, who include 1 executive staff and 2 supervisors. So some barriers we have faced during the implementation has been the staff turnover, which I know everybody knows is one of the issues that we face with IHS, and time burden on existing staff due to competing priorities. Regarding feedback, Alona just explained to you that we're currently utilizing the AHRQ surveys, which will be turned over to each service unit once the PATH is gone. You want to?
No, I guess there's more to come on that, just more logistics, I guess, as far as creating a SurveyMonkey account, whether it's from an area level or at a service unit level. So as that progresses, if anybody is interested in how and how to set up an account, you can give me an email if you want, ajarman@mpqhf.org.
Okay. All right. So next slide, please. Okay. So what are we planning to do? What is our next step? So right now we're requesting an on-site Just Culture workshop for all the CRO service unit supervisors and quality teams, which would be facilitated by the Outcome Ingenuity. Also, we plan to revise the current culture of safety policy, and once that's done, the name will be changed to Just Culture Policy. We also have root cause analyses and team management training for the quality team. Team steps, we have team steps trainings that we plan to do on August 22nd. They should be coming out on August 22nd. Hopefully, you know, we don't change that date because this has been changed a couple of times, but we're working on that. We also plan to develop internal tools for the incident reporting, performance review, grievance, and complaints processes. And after all the changes, we plan to utilize those tools, those online tools, to be able to focus on the incident reporting, performance monitoring, and all those processes. And hopefully we can fully implement the Just Culture once all that has been implemented. And that's it for us, unless you have one or two things you want to add.
No, I think I was just gonna go back. You did mention the trauma-informed care training.
Yeah.
Okay. Yep.
So the trauma-informed care will be August 22nd. Yep. I think that's it. Thank you, guys.
Thank you. Are there any questions for the group in Crow? We can take just a minute or two and see if there are any questions from the group. Please feel free to unmute and ask them out loud or enter them into chat. I see one that came through. Can you share your Just Culture policy?
So basically the policy is just focused on, the culture of the how you present yourself and how you, your code of conduct to patient care, and also how you communicate and how you work as a team in providing quality care to the patient.
Sure. Would you guys be willing to share that document? We could potentially share that with the participants. Thank you. All right, any other questions before we move on to Cass Lake? All right, I see another one has come in. Are you using a particular model for RCA training? Root cause analysis training.
So we haven't decided on what model we're going to be using, but we are currently working on it. But I can send your information once we have that all set up.
We use the Joint Commission tool.
Besides using the framework that was given to us by the Joint Commission, is that what you're referring to? Because at this time we do meet with the root cause analysis committee to discuss Westidents that could present that could be a sentinel event, and those we follow the questions from the framework, and that's how we decide on how action items or action plans are developed for each individual that was involved in the incident.
All right, thank you. Looks like we got a couple more questions coming in. How do you translate the RCA to the Just Culture causal diagram to determine which algorithm to apply?
Wait, let me go back up here.
Yeah, we might.
Yeah, it's just like
we might actually have to capture these questions and
Okay.
provide written answers. So we'll do
Okay.
a summary sheet of the questions with
Okay.
kind of the Q&A answers so that we can move on time-wise.
I think that would be interesting.
Yeah.
And I guess just to sum up, they have used quite a few IHI tools as far as their PDSA and other CLAPI tools that they have. So, and then the specific Joint Commission documents that they have, Olu is correct in saying that it does kind of refer back to whether or not your websident or error, whatever, would relate to any of the Sentinel events. And then just going back through there, I think the discussion may be in terms of how to create a proactive approach to certain domains, whether it's a communication breakdown or psychological safety, whatnot, would possibly to use the Joint Commission tracer methodology. And then within there, if any of you are familiar with that, and then using the SAFER matrix to determine the risk and the scope. So, and we can definitely get more on that. I don't want to take up more time.
All right, thank you, Alana. Yeah, I think that'd be great to include some of those resources or guidelines, or even a list of some of those when we create our summary sheet here. All right, with that, I think we will move on to Cass Lake. So we're going to hear from Ellie today.
So I guess you want to just flip, or I guess I could tell a little bit about myself. So I've only been at Cass Lake since the end of January. I am the acting quality manager currently, fulfilling that role right now. First time in quality, I was a nursing supervisor for 17 years in Red Lake, Minnesota, and then I've been with IHS numerous places since September in 1998. So there's a little bit about Ellie. We can flip to the next slide. This is a little bit about Cass Lake. It's located in northern Minnesota, nestled in the Chippewa National Forest among the land of the 10,000 lakes. Thanks, Carrie, for the picture of the water on the first slide. Kind of represents a lot of what our state of Minnesota is. Patient population is 10,525. All this data is from 2018. ED visits, 8,025. Urgent care visits, 7,155. And then that's how many prescriptions we fill per year as of 2018. Our urgent care, a little bit more about that. Our urgent care closed for a little brief moment, and then it's getting started back up here within the next couple months. We're going to have that. It's going to be called same-day walk-in clinic. So we can flip to the next slide. So our implementation plan here, like I said, I've only been here since the end of January, but it's been one of the projects that our CEO has embraced and wanted me to focus on since I've been here. So 3 of us went to Just Culture training with Carrie in the area office in Bemidji on February 14th to come back and be champion trainers at our facility here. And then me and Rebecca went to Albuquerque May 14th and did a 3-day with Outcome Ingenuity training, more in-depth training at that point in time. Next slide. So this looks a little bit backwards because like after we did the training with Carrie in February, me and Jason came back and we actually, our CEO wanted us to kind of get this going because at that point, all the supervisors in Cass Lake had the training, and now he wanted us to spread it out to the entire facility. So we had 3 days of hour-long trainings for all of the staff. Me and Jason presented for them, and we got a good majority of the staff done at that point in time. Out of 165 employees, we accomplished, I think, 140 at that point. We had like about 25 left to do. And then also with that being noted, he made it mandatory for everybody to have the training. So talk about leadership embracing a process. I have to do kudos to our CEO because he did that for us and made it a little bit easier for all of us to embrace this process. With that being said, I'm still continuing to do trainings for the staff. And we also wanted to have a way of seeing where we were moving with this, having some data to reflect if we were moving in the right direction with our staff. So our web students was what we were going to focus on, collecting data from that and seeing if those were going to increase from this implementation of Just Culture. We also implemented the SBAR, and I don't know if you're familiar with that. That's Situation, Background, Assessment, and Recommendations. It's a tool that you can use. We paired that up with our web students. So like if a person put in a web student and it was pretty straightforward, then we wouldn't have that staff member do an SBAR. But if it needed a little bit more, if we needed a little bit more information, then we would attempt to have them do the SBAR for us so that we can get that information that we needed for that. Next slide. Here's some data that we have for our web students, Q3 of 2019. You can see the ones that are pending, the SBARs yet to be completed, the ones we closed out. And then you can see the slide on the right, the categories of our web students, so that we can see what we needed to focus on and what the web students, how many web students we had in each category. So this is still a work in progress. We were struggling to find a way of collecting data to see where our Just Culture was in our facility, and we thought this fit the best for our facility. Next slide. So when we did that, and we're monitoring these web students, currently just the safety officer was closing them out, putting the SBARs out, and he was talking with the supervisors. We actually sat down at our exec meeting and we decided that, you know what, we need a little bit more. We need a team approach to this so that he wasn't the only one having it on his shoulders, and he felt like he needed a little bit more brainstorming and a little bit more assistance with it. So we created a team now, and we're just now in the process of implementing that team. So the team will be leadership with Jason, and Jason is our safety officer, with him, and going over these web students and these SBARs to see what the next steps would be and see what more we need to do to help our facility concentrate on those focus points of where we're at risk for safety. So we added the Just Culture to our new employee orientation too, and we're putting it into our annual trainings. So, and I just did another class to make up for those 25 that needed to be completed yesterday afternoon. So we are now at this point, there's 5 of current employees that haven't taken the Just Culture, and all of the new employees have completed Just Culture through their new employee orientation. So our AHRQ survey results, we had focused on the 2017 one, was the last one we did here at Cass Lake, and that part of that was implementing Just Culture. And we just completed our last one here for 2019. Carrie helped us with that. And with the data that we have from that, our CEO wants to have an all-staff meeting and review the high points to get their input and get their voice of what direction we want to move with the results of that survey. And like Carrie said, this isn't something that's going to change overnight. We got to be patient, we got to be dedicated and committed to this process, and our leadership is very committed and dedicated to this process. And you can tell in the management and the supervisors, just from the trainings that I did as of April to now, I have them stopping in my office and asking questions, and it's just nice to have that feedback from them to come and meet with us and say, yeah, this is really something that we need here in our facility. Like Crow was talking about how their staff is leaving and the turnover. Yeah, Cass Lake has that too. I haven't been at an IHS facility that hasn't had that. So it does kind of bang on the morale of the facility. And this Just Culture is something that I embrace, and I think it's just awesome that we can have that openness so people feel like their voices are heard and that we're going to make a difference in their work environment for them. Next slide, I think am I done?
I think that was the last one. Thank you so much, Ellie, for sharing. Was there maybe time for one or two questions for Ellie? It looks like one just came in. How much time is dedicated to Just Culture training during new employee orientation?
An hour.
An hour. Okay, excellent.
Yep.
So you really go through it in depth, the model and the expectations.
Yep, we have a pre-test and a post-test for them to do, and then we leave a lot of, not a lot of time, but I do it slow enough so that I have interaction with them about, like, have you ever had this happen, so that it's real life situations that they can kind of talk back and forth with me.
Excellent. Excellent. Thank you. With that, I think we can move to the next slide, and we will hear from Jennifer at Claremore.
Can you hear me?
We can.
Okay, great. So my name is Jennifer Sankachan, and I am the Assistant Nurse Executive at Claremore Indian Hospital. We are a part of the Oklahoma City area, and our specific service unit is located in Northeast Oklahoma. Next slide. So this is a rather busy slide, but I wanted to provide just an overview of the number of departments that our facility encompasses and the various services that we provide. So as a hospital, we are a 44-bed facility. We provide inpatient as well as outpatient services, as you can see. So everywhere from ER to ICU and med-surg. We have everywhere the full spectrum of women's health care, from clinic through labor and delivery. So this is just something that we have to consider as we plan moving forward with how we will implement Just Culture throughout our facility. We have many, many different players in our game here. So next slide. So our implementation plan is structured in 7 steps, with the first being executive commitment, which has been emphasized, I think, appropriately throughout this presentation. So engaging executive leadership in gaining their buy-in and support and commitment to the concept of Just Culture. Our next step then will be to develop our champion team. So we had 2 individuals from our service unit and 2 individuals from Lawton Indian Hospital that attended the Just Culture training in Albuquerque earlier this year. And all 4 of us are now certified Just Culture champions. So we're excited about that. So we will next look to who else we have in terms of colleagues and coworkers that feel passionate and are motivated to participate on a champion team that will act as sort of leaders and resource support personnel going forward. Step 3 is integrating Just Culture concepts throughout our policies and procedures. And we've discussed as well integrating Just Culture concepts into our performance evaluation, our PMAPs for our employees. So just all the different levels, the different ways that we can be consistent and really thoroughly integrate the basic foundational concepts of Just Culture. Our next step then would be to train our managers, so gain buy-in from management. So our implementation plan sort of goes from, in a sense, most involved to less involved. So it really is kind of building up from the foundation of a pyramid, sort of, in a way. So orienting our managers to more basic, on a more basic level, the concepts of, you know, what a good system design is, and having them become familiar with the Just Culture algorithm. Next slide. So our fifth step would be to look at really take a good look at our learning systems and identify and explore how we can change our learning systems to align with Just Culture. So basically, where we would focus on, you know, how can we build a stronger system that will help our employees make better choices. So just kind of a shift in our thinking and, you know, therefore in our culture, looking at events as, you know, opportunities for improvement, and asking why, you know, why did this happen, instead of, well, how bad was it, and, you know, who did it. So really a shift in culture in the way that we approach events. Step 6 would be staff training. So our frontline staff, patient care staff, support staff, you know, so the rest of our employees. On the basic level, we want you know, facility-wide, we want our employees to be familiar with the 3 behaviors model, with this learning systems approach, and then to have a general idea of what it means to have a good system design. So building those multiple layers into our system that make the system safer and essentially make it more difficult for an employee to have a human error or to, you know, succumb to an at-risk behavior. Multiple safety checks, safety nets where, you know, several different things have to align in order for an error to be allowed to occur. Step 7 is looking at how we will collect data, how we will determine our level of success. So watching how our outcomes change, assessing to see if there are differences in the behavioral choices that we're making, how our employees' attitudes are toward Just Culture and toward the progress that we're making. Developing a system definitely to measure how well we're doing with building a strong system. So looking at all the ways in different areas where we've implemented multiple levels of safety checks, essentially. And then continuously maintaining a timeline of our progress. So just kind of documenting each step, what was done, who was involved, or some of the ways that we're planning to measure as we go forward. Next slide. So in terms of progress, again, we had 2 staff members from Claremore and 2 from Lawton that attended training, completed our certification proficiency exam, and plan to work together both, you know, with one another in each of our facilities, and also collaboratively for, you know, our area, for the Oklahoma City area. So it's really exciting because all 4 of us that attended are very supportive of this, the Just Culture concept, the safety culture, and so we're excited to have the opportunity to work together on this going forward for our area. Next slide. So what we will do next, the first thing that we are going to focus on is obtaining a true baseline assessment. So I believe in our training that we attended, part of the training indicated that that true baseline assessment for a facility really takes maybe up to a year. So all of the ways that we're planning to measure data, measure progress, and measure our outcomes, we're first focusing on looking at how we are. So what is our culture? What cultural norms do we have? How do our employees interact with one another? How do they impact one another? What behaviors are truly role models? So assessing how we are now so that we have a better idea of when we begin to really implement, we can measure our success. So our Just Culture champions at the same time, we've begun to develop ideas for how to actually implement. So using the resources that we gained from the Just Culture training that we attended, customizing the PowerPoint slides for our facility and area, and just brainstorming about interactive ideas for how we can engage our employees when we are at the point where we actually are ready to implement the training. So again, we're really excited to have this opportunity, and we're excited to see where Just Culture takes us, and also, with the understanding that you have to be patient, of course. So I think 3 to 5 years was quoted as the amount of time that it truly takes for a facility to change over, to evolve into Just Culture. So, and I think that's the last slide for me, I believe.
Yes, thank you, Jennifer. Thank you so much for sharing. With that, we are right at the hour, so I'm going to ask Elaine to skip to our last slide. And I just wanted to briefly introduce our session topic for next month's LAN session. So that'll be on September 4th, the same time and place. And we are going to be talking about patient, family, and community engagement. And again, hearing from some facilities about what they're doing in their local communities around this topic. So I think it'll be a really great discussion again. If you have any questions, additional questions for Jennifer and or any of the other speakers, please enter them into chat. We will capture those and we'll respond to those in that Q&A document, summary document that we'll prepare and then post on our PATH LAN website. If you haven't done so already, please do fill out our brief poll that Elaine has launched for us there. We will leave the session open for at least 5 minutes after the hour, so you've got plenty of time to fill that out. Thank you all for joining us today. I think it was a really great topic, and we look forward to seeing you next time.